But India suffers because it has still a huge burden of infectious diseases, but it has this new burden. So if we look at the number one cause of death, it's cardiovascular disease. So that means heart attacks, coronary heart disease, and then other kinds of cardiovascular disease like stroke. They require different interventions. So the solutions to prevent and treat NCDs, non-communicable diseases, are more complex than what we have to do for infectious diseases. So most NCDs are caused by a change in lifestyle, so adoption of a more sedentary lifestyle, eating food that is less healthy, less plant-based food, more fat and animal fat food. So we have to work on behavior, perceptions of what a healthy lifestyle is. But interestingly and importantly, we also have to work on the healthcare system, because when we find people with risk factors for cardiovascular disease, they usually need to be treated in a medical setting. Likewise, when people develop coronary disease or cerebrovascular disease, stroke, they need healthcare. So we have to work both through the kinds of policy things that promote healthy living, but also in providing access to high quality care to treat early disease or prevent disease. The burden of disease study has documented that there's a gap in India in terms of the quality of healthcare and access to healthcare. So clearly that needs to be worked on. It's important to remember though that we will never have enough physicians or healthcare facilities to treat an epidemic of cardiovascular disease. We also need to work on prevention through those things we talked about: exercise, healthy living, and treatment of risk factors. Now, in terms of quality of care, right now, India, as an outsider, I see, is working hard to improve access to care. But quality is also important, because access to care that's not quality, that's not effective, doesn't do people any good. So now I think India, in addition to focusing on access, really needs to think about how to improve quality of care. Well, I think most people want to live long and have a healthy life. So understanding the risk associated with tobacco use, with high-fat diets, with high-salt diets, with sedentary lifestyles, that's clearly important. We know that knowledge alone doesn't change behavior, right? That you need interventions that reinforce the positive outcomes of adopting a healthy lifestyle. So it's very important. It's not alone, not enough. For example, the most effective intervention we know for preventing people from smoking or getting them to quit smoking is policy interventions that ban smoking in public places. That alone in New York City in 1 year caused 15% of smokers to quit. And likewise, making tobacco more expensive so young people can initiate smoking. So some of the things that we need to do are policy. Well, healthcare management education is incredibly important, because it's easier to build facilities and buy equipment than it is to have those health systems run effectively. So management and excellent management that understands evaluation, understands indicators of quality, understands how to improve the management of the healthcare system is essential to helping India solve the problems we have here with chronic disease. Global burden of disease study also emphasized the importance of environmental components here in India in terms of decreasing health. So especially levels of ozone, air pollution, they lead to a variety of conditions. And that's an area that if we want to improve health in India, we have to deal with the environmental component.